Currently, 1 in 7 couples has difficulty conceiving, and many experts in the field predict that this could double over the next 10 years. The fact that infertility rates are rising suggests that specific factors in modern daily living must be responsible. A woman's peak reproductive years are between the late teens and late 20s. By the age of 30, fertility starts to decline. This decline becomes more rapid once you reach your mid-30s. By 45, fertility has declined so much that getting pregnant naturally is unlikely in most women. The most common foods linked to infertility are gluten, wheat, alcohol, and caffeine, although there are others that may also be the culprit. Having a food intolerance test is a wise idea for anyone wishing to become pregnant, especially those who are having difficulties. Generally, the diet should consist of fresh, home-prepared meals containing a variety of vegetables and fruits. Organic foods should be used where possible, since they have higher mineral content, and pesticides may also cause other unwanted stresses on the body. Antioxidants like folate and zinc may also improve fertility for both men and women. They deactivate the free radicals in your body, which can damage both sperm and egg cells. Celiac disease is a condition where the lining of the small intestine becomes damaged due to wheat sensitivity. The fine lining, or the villi, in the small intestine is responsible for absorbing vital nutrients from the food that you eat. And when they become damaged, it can cause a wide variety of medical problems, including rashes, IBS, malnutrition, and many more. It may be hard to imagine also that celiac disease has any relation to infertility, but new research is beginning to point in that direction. Finnish researchers determined that celiac disease rates for infertile women are about 4%. While doctors are still not sure the exact correlation between celiac disease and infertility, it's hypothesized that unmanaged celiac disease leads to a shorter reproductive cycle and to earlier menopause. These new studies go a bit further and suggest that celiac disease is also responsible for lower birth weights, higher risk of abortion, and decreased breastfeeding time. This also would indicate that it's important to adopt a gluten-free diet if you're having any issues here. You should eat a substantial breakfast. This may help with some of your fertility problems. One study found that eating a larger breakfast can improve the hormonal effects of polycystic ovary syndrome, which can be a major cause of infertility. For moderate weight women with polycystic ovarian syndrome, eating most of their calories at breakfast reduced insulin levels by 8% and testosterone levels by 50%. Higher levels of either can contribute to infertility. You could check out my other video on polycystic ovary syndrome for natural ways to help to treat this condition. In addition, in this study, by the end of the 12 weeks, the women had ovulated more than women who ate a smaller breakfast and a larger dinner, which suggests improved fertility. It's important to note, however, that increasing the size of your breakfast without reducing the size of your evening meal is likely to lead to weight gain. Eating healthy fats every day is important for boosting fertility and overall health. However, trans fats are associated with an increased risk of ovulatory infertility due to their negative effects on insulin sensitivity. Trans fats are commonly found in hydrogenated vegetable oils, and they're usually present in some margarine, fried food, processed products, and baked goods. Studies have also found that a diet higher in trans fats and lower in unsaturated fats is linked to infertility in both men and women. Refined carbohydrates may be especially problematic. Refined carbohydrates include sugary foods and drinks, and processed grains, including white pasta, bread, and rice. These carbohydrates are absorbed very quickly, causing spikes in blood sugar and insulin levels. Refined carbohydrates also have a high glycemic index. The glycemic index tells you if a carbohydrate-dense food will raise your blood sugar significantly. Insulin is chemically similar to ovarian hormones, and these hormones help our eggs mature. Consistent elevated insulin can cause the body to produce fewer reproductive hormones because it thinks that it doesn't need it. This can contribute to a lack of egg maturation and a lack of ovulation. Fiber helps your body to get rid of excess hormones and keep blood sugar balanced. Certain types of fiber can help to remove excess estrogen by binding to it in the intestines. The excess estrogen is then removed from the body as a waste product. One study from 2009 associated soluble fiber, such as that from avocados, sweet potatoes, oats, and fruit, with lower levels of estrogen and progesterone. Soluble fiber from fruit especially had the strongest association with lower concentrations of estrogen. Some examples of high fiber foods are whole grains, fruits, vegetables, and beans. The daily recommended intake of fiber for women is 25 grams per day and 31 grams for men. One 2009 study found that eating 10 grams of more cereal fiber per day was associated with a 44% lower risk of ovulatory infertility among women who were over the age of 32 years. Replacing some animal protein, such as meat, fish, and eggs, with vegetable protein sources, such as bean, nuts, and seeds, is linked to a reduced risk of infertility. A study showed when 5% of your total calories came from vegetable protein instead of animal protein, the risk of ovulatory infertility decreased by more than 50%. A 2018 study concluded that eating more fish correlates with a higher probability of live birth following infertility treatment. Consider replacing some proteins in your diet with proteins from vegetables, beans, lentils, and low-mercury fish. High intakes of low-fat dairy food may increase the risk of infertility, whereas high-fat dairy food may decrease it. One large study from 2007 looked at the effects of eating high-fat dairy more than once a day, or less than once a week. It found that the women who consumed one or more servings of high-fat dairy per day were 27% less likely to be infertile. An estimated 20% of ovulatory infertility may be avoided if women consume 3 or more multivitamins per week. Micronutrients found in vitamins have essential roles in fertility. For women trying to get pregnant, a multivitamin containing folate may be especially beneficial. Some of the most important nutrients for a fertile system are the B vitamins, selenium, omega-3, iron, and vitamin E. Vitamin D has been linked to a variety of health benefits. For women trying to conceive, it appears to be linked to better fertility, as well as a healthy pregnancy. Because of these potential benefits, you should get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Coenzyme Q10 plays a crucial role in energy production inside the mitochondria. As people age, cellular production of CoQ10 decreases, so an older woman's eggs are less efficient at producing energy. This reduced energy production can lead to poorer fertilization and earlier embryo loss. The best form of CoQ10 is ubiquinol, and doses can range from 100 milligrams to 400 milligrams per day. You can learn about other mitochondrial boosting supplements such as PQQ, D-ribose, creatine, and the research chemical SR9009 in my video on the mitochondria. Also, exercise and cold water are other ways to help to boost mitochondrial activity. Resveratrol is an anti-aging, antioxidant, anti-inflammatory, and insulin-sensitizing natural polyphenoic compound. Growing evidence indicates the resveratrol has a potential therapeutic effect in infertile women with diminished ovarian function, polycystic ovary syndrome, or endometriosis. Common doses are 500 to 1000 milligrams per day, taken in the form of trans resveratrol. Low levels of thyroid hormone can interfere with the release of an egg from your ovaries, which impairs fertility. In addition, some of the underlying causes of hypothyroidism, such as certain autoimmune or pituitary disorders, may also impair fertility. You could check out my video on the natural treatment of autoimmune disease and my video on treating hypothyroidism for more information. One common recommendation for a woman trying to conceive is to increase their intake of iodine, a nutritional mineral which helps to ensure healthy fertility, conception, and pregnancy. Not only does it help to treat hypothyroidism, but it's also required by the body for the synthesis of sex and stress hormones. There are many hormone-disrupting chemicals that are implicated in infertility. One, for example, is how the coating on non-stick pans have been linked to triggering earlier menopause. Disruptions in female reproductive functions by endocrine-disrupting chemicals may result in subfertility, infertility, improper hormone production, estrus and menstrual cycle abnormalities, and ovulation and early reproductive senescence. A few of these chemicals are pesticides, heavy metals, and plasticizer alternatives. There's a very large list that you should familiarize yourself with. Although many recommend soy after the menopause, they contain plant-derived estrogens called isoflavones, and if you eat too much of this, the isoflavones can have a negative impact on the female body and on the ability to conceive. There's lots of evidence to suggest that there's a connection between heavy metal toxicity and subfertility. Lead and cadmium are particularly related to conception issues, in addition to miscarriage, prematurity, and low birth weight. Other heavy metals, such as mercury or aluminium, may also be involved. Cigarette smoke, both first-hand and passive, unfiltered water, tin tuna, and old paint are some of the instigators of heavy metal toxicity. You could check out my video on mercury fillings to learn about the natural ways to restore your glutathione levels, which is the master antioxidant in the body that's responsible for detoxifying these heavy metals. Other factors that may result in subfertility are candida, hormonal imbalances, infection, endometriosis, and ovarian cysts. You could check out my other videos on polycystic ovary syndrome, on endometriosis and on candida for more information about these specific conditions and ways to treat them naturally. Exercise has many benefits for your health, including increased fertility. Increasing moderate physical activity has positive effects on fertility for women and men, especially those with obesity. The trick is that moderation is the key. Excessive high-intensity exercise has actually been associated with decreased fertility in certain women. Excessive exercise may change the energy balance in the body and negatively affect your reproductive system. Excessive exercise is also linked to excessive inflammation, and this can bring on autoimmune conditions, which can result in hormonal imbalances. In my other videos, I talk about how the excessive exercise requires a higher dose of antioxidants in order to neutralize the excess free radicals and prevent the inflammation and inflammatory-related illnesses. Similarly, excessive exercise can lower body fat too much, and it's known that cholesterol is required for its conversion into cortisol for stress control and into DHEA, testosterone and estrogen for optimal hormonal function, all which can have a negative effect on fertility. One of my lecturers has told me how she's successfully treated numerous patients' infertility by just telling them to have bacon and eggs for breakfast to ensure they have enough cholesterol for this hormone production. A recent study has shown that women with the highest stress levels are much more likely to fail to get pregnant within 12 months of trying. The study was published in the most recent online edition of the journal Human Reproduction. Researchers from Ohio State University tracked 373 American women aged 18 to 40 who had just started trying to conceive. Their progress was followed over a 12-month time period, or until they became pregnant. None of the subjects had any known prior infertility problems. The results also showed that high levels of preconception stress more than double the chances of a woman failing to get pregnant after 12 months of trying. Previous research has already shown a link between high stress levels and a reduced probability of pregnancy. The researchers recommended yoga and meditation for those hoping to become pregnant. Regular exercise, eating healthy with a nutrient-dense diet also increased the chances of success. Again, during stress, your body uses its pregnenolone stores, which it synthesizes from cholesterol, to either make cortisol stress hormone or DHEA, testosterone and estrogen. Therefore, it's logical that increased stress decreases essential hormonal levels. Some supplements to help control this cortisol stress hormone are Tulsi tea, also known as holy basil tea, and the supplement phosphatidylserine when taken at doses of 600 to 800 milligrams per day. Sleep is also related to cortisol control and stress reduction. You can check out my video on herbs to help you sleep for more natural solutions to help improve your sleep and to reduce this stress. New research from the National Resource Defense Council found that household dust contains a cocktail of hazardous chemicals that can cause a variety of health problems, including cancer and infertility. Researchers say the chemicals in the household dust come from flooring, electrical equipment, beauty products, and cleaning products. Vitex, the chasteberry. It's a popular herb for balancing the menstrual cycle and resolving PMS. It lightly acts on the pituitary gland in the brain, increasing the strength of the luteinizing hormone surge, which triggers ovulation. This in turn can strengthen ovulation and progesterone production in the luteal phase. It's also been shown to decrease abnormally high prolactin, thus improving hormone balance and ovarian function. This herb helps women with ovulation problems and women with luteal phase defect who have a short luteal phase or low progesterone production. Maca has been in use for thousands of years as a libido and fertility enhancing medicine. It's indigenous to the Peruvian Andes and it's a tuber like a turnip. It acts as an adaptogen, helping the body cope during times of increased stress, but it may also affect androgens, such as testosterone, in both men and women. It's unclear if its effects are actually on the level of testosterone or just on the receptor, but it's been shown in both men and women to affect fertility positively. In light of the effects on testosterone activity, however, this supplement may not be helpful for women with polycystic ovary syndrome, which has been associated with elevated levels of androgens. It has a reputation where it's grown for being able to make infertile sheep conceive. The herb Tribulus terrestris can be helpful for both men and women with fertility problems. In women with irregular ovulation, especially due to polycystic ovary syndrome, Tribulus can help to normalize the cycle and create predictable ovulation. One study showed it also increased conception rates when both partners took it. In addition to relieving period symptoms, evening primrose oil helps you to produce good, fertile cervical fluid. This extra layer helps to protect sperm as they make their way to the egg, leaving a greater chance of fertilization to occur. It's safe to use from your period to ovulation. Red clover is estrogen's twin hormonally. Though not identical, they can both serve the same purpose. As red clover helps to thicken the uterine lining, which leads to better implantation, it has the potential to increase your fertility. Black cohosh can stimulate your ovaries, and better yet, the eggs inside. If nothing else, it helps to relieve the feeling of menstrual cramps. However, it should only be used in the first half of your menstrual cycle to prevent problems. Ashwagandha enhances the endocrine system and thus helps regulating the thyroid and the adrenal glands. These glands are responsible for maintaining the balance of the reproductive hormones, and hence they play a very important role in the treatment of female infertility. Ashwagandha is also very rich in iron. Shatavari is a superb fertility tonic for women, balancing hormones as well as providing nourishment and strength to the uterus. Shatavari acts on the immune system and it helps in stressful times, so it's ideal for stress-induced and immune-mediated infertility. Women with severe depressive symptoms have a decreased chance of becoming pregnant. You can check out my videos on various mental health conditions to learn more about natural treatment methods. Any amount of dopamine that's out of the normal range could possibly cause infertility. It's often in high levels in those who have high stress and who've been on antidepressants. Dopamine is what switches prolactin off. So, if you're lacking dopamine, the anti-conception switch could just be staying on. You could check out my video, Know Your Neurotransmitters, Dopamine, for more information about this. The previously mentioned herb, chasteberry or vitex, also has dopaminergic activity.